Welcome to today's episode of Understanding COVID-19 webinar series. This is the 7th episode, and we are very pleased to host Professor Karuti Kanyinga. And before we start, I will begin by reading his bio. Professor Karuti Kanyinga is a research professor of development studies at the Institute for Development Studies, that is IDS, University of Nairobi. He is an accomplished development researcher and scholar with extensive national and international experience. Karuti holds a PhD in social sciences from Roskilde University in Denmark. He has published extensively and is renowned for contributions to scholarship and knowledge in governance and development. Professor Karuti's research and publications include seminal work on ethnicity and development, devolution and development, electoral politics and development. This is in addition to commissioned studies on governance, justice, law and order, sector reforms. The publications include the Oxford Handbook of Kenyan Politics, that is published in 2020, which he co-edited with Professor Nick Chisman and Professor Gabriel Lynch. He has also published in 2019 with Odote, and the topic and the research was on the judicialization of politics and Kenya's 2017 elections. That was published in the Journal of Eastern African Studies. He has also published in 2007, The Legacy of the White Highlands, Land Rights, Ethnicity and Post-2007 Election Violence in Kenya in the Journal of Contemporary Studies. And finally, in 2000, he published a journal article on the redistribution from above, the politics of land rights and squatting in coastal Kenya. That is the Nordic Africa Institute. So I will hand over to my colleague, Dr. Alex Awiti, for a short introduction before we start this webinar. Dr. Awiti.
Thank you very much, Juki. Thanks, Kitonga. And Prof, it's great to have you on this conversation. So I'll tee this off by saying that nearly 6.3 million people have been infected and about 376,000 have died of COVID-19. Since the novel coronavirus was reported in the Wuhan city in China. The disease has no known cure or vaccine, and vaccine is yet to be developed. Governments have responded with the non-pharmaceutical interventions, as we call them, social distancing, restrictions of mobility, large gatherings, including funerals, worship, and entertainment, sports, have been suspended by presidential or local authority orders. Curfews have also been imposed in many countries. In the process of containing the spread of COVID-19, have governments always acted by the law and in the best interest of individuals and their societies? Are existing bureaucratic, centralized or weakly devolved structures of government equal to dealing with the pandemic? And are we doing any better at the global governance level? So I hand it over to you, Prof, and I look forward to a very lively conversation.
Thank you, Alex. My pleasure. May I begin by saying that it's my pleasure to be here today to discuss these important issues on governance and accountability in the context of COVID-19. And to begin with, I think the point you raised regarding how governments across the world have responded to COVID-19 is an interesting discussion, because what is very clear now is that many governments are acting in a manner that leaves no doubt that no one is watching them. And therefore, many of them are doing things that are many things using the excuse of COVID-19. We have seen some countries becoming quite autocratic in how they deal with the COVID-19, imposing curfews without any discussions with the general public. That has been a trend, especially in Southeast Asia. China, for instance, tops that list of a very repressive approach to to the general public. We have seen in our neighborhood here in Tanzania, where they have even claimed, where the government doesn't want even to recognize that COVID-19 itself is a challenge. We have seen instances in Kenya here where we've thrown the rule of law out of the window, where we have seen police actually acting in a manner that reneges on quite a number of gains that had been made with regard to how to handle crowd control. I mean, how to control the crowds, how to respect individual citizens' rights, and so on. We have seen police behaving in a manner that has not been seen in the last 4 years in this country. When you look at the Eastern Africa region, Burundi tops the list again of a government that again has decided that there is no coronavirus in their vicinity, and they are repressing citizens in different ways. If you look at it generally, what comes to mind is that this has become an opportunity for many governments to do the wrong things because no one is watching them. It's not even in America, it's not UK, it's not in Europe. Many governments have shown an inclination towards general repression of the societies. There are some even who have argued, unfortunately, that to prevent COVID-19 from spreading and affecting more people, you don't need democracy. And that that's an argument that leaves a lot to be desired, because we know successive governments, those that have done very well, have done so because of consulting with the people, because of being very proactive in terms of asking what do the people want and how can we best ask the people themselves to become much more vigilant in terms of preventing the spread of the disease. But at the same time, I think there is also an interesting dimension, and I think, Alex, you've raised it, about relationships between two levels of government, where we have got the national and the devolved systems of government. I'm very surprised that in the US, for instance, President Trump is always referring to the governors in different states and the role and the way he consults with them in terms of implementing various strategies on the spread of coronavirus. In our situation, we have developed a system of government, and everyone can remember that when we began talking about measures to prevent coronavirus, the first thing we witnessed was the government, the national government, concentrating a lot of powers and usurping the powers of the county government in the health sector in many ways. And today, it leaves no doubt that the national government is the one which is in the front line of fighting the spread of coronavirus. But the way the government has done so, it leaves no doubt again that it is very keen to centralize its authority in the health sector. The good news in this regard is that we have seen a joint secretariat and joint committee that has been established, and that joint committee has representation of the Council of Governors, which is a good thing, because the Council of Governors now will come in and represent the devolved units. But far from that, we have seen the national government not giving the county governments the resources that are required. This implies that even at the county level, where we expect the counties to be leading in terms of preparedness, those counties themselves do not have adequate resources to do what they should be doing. So we are talking about, on the one hand, the health sector being a devolved service, and fighting COVID-19 becoming a major responsibility of both the national and the county governments. But we haven't seen a very close relationship in this respect. And that really raises a number of issues about what is likely to happen post-COVID-19. Will the national government continue dominating the health sector? And what would that mean for devolution?
Yeah, so I guess, the deeper question then is, you raised a number of interesting issues about, the inclination to autocratic repressive tendencies. But when I speak with Kenyans who basically feel that in this surge period, we probably didn't do the right things in the beginning, they make references to countries like China, they make references to countries like Burundi, like Rwanda, and it leaves me with little doubt that citizens are looking for strong, decisive leadership. But the question is, there's a very fine line between strong, decisive leadership and autocratic tendencies. What do you have to say about that?
Alex, I think let's have some caveat in that particular statement, because what I've noticed in the last 2 months is that Kenya actually seems to be operating in relation to COVID-19. Kenya seems to be two countries in one. The ordinary person in the slums of Nairobi, in the high density areas of Nairobi and many urban centers, are not concerned about COVID-19. It is of less significant compared to the challenges that they live on everyday basis. Social distancing and other guidelines that have been imposed are difficult to adhere to. If you want to talk about hard washing, the people in the poor areas pay more for water services than you and I who live outside of those informal areas. The middle class, the affluent, are the ones who are very worried about coronavirus, and they are the ones who are calling for autocratic leadership and for more repressive approach on how to address the spread of the disease. You may want to guess why is it that people are thinking differently in the same country. And I'm saying this out of conviction that in the last 2 months, I've really committed myself to look at what was happening in town. I moved around in both the upmarket areas of this city and high density slum areas of this city, and I can tell you there is a difference in how people are reacting to the proposed to these guidelines. But having said that, let me emphasize that the problem that we have across the world is that pandemic is being treated in the same manner. So everyone is using a generic approach, forgetting that a pandemic becomes an epidemic when it starts affecting people in a particular country. So we must be asking ourselves as Kenyans, what's the best way of controlling the spread of the disease? We shouldn't be thinking about cut and paste approaches from the West. If you look at countries that have had the experience of Ebola as an epidemic, not a pandemic, as an epidemic, you realize that most doctors, most public health workers, and even government itself argues very convincingly that they succeeded in mitigating the epidemic by having consultations with ordinary citizens from the grassroots upwards. And it begins by telling citizens the reality and exposing them to the consequences that are likely to come, and then they design solutions themselves. I can tell you with a lot of certainty that in some parts of this country, if you are coming from Nairobi, the moment you reach the rural areas, it's the citizens who are calling the police and health workers to arrest you, right? And they are doing that simply because they are convinced that if Nairobi is locked down, why would you be coming to the rural areas? And yet they are also worried. So I'm simply saying that the first thing we missed out is actually to have serious consultations and to ask every community, every part of the country. The coronavirus is going to assume the dimension of an epidemic. It's likely to come to our own area.
Just to push this a little bit, I think this is just a question of fractal hegemonies. We're getting this stuff drummed through our throats from WHO on guidelines for non-pharmaceutical interventions. The government takes the same measure, the same structure, and rams it down the throat of citizens and say, you must do this, you must do that. So to your point about Western methods that are being used to to deal with this. I think it's a global hegemonic, it is a structural hegemonic problem. But having said that, I think you raise a very interesting point that presents interesting contrasts or contradictions. One is when you look at the way the police implemented the first wave of lockdown measures, they brutalized deprived poorer neighborhoods. I didn't see them, I never heard of Kilimani residents being brutalized and tossed off the streets with their cars. It was in Likoni, it was in Kawangware, it was in Kibra, it was in these poorer neighborhoods. Now, what I'm suggesting is that the repressive character of state and the manner and the logic of policing is just playing into the pandemic, and this is exactly what we do structurally. And the way that we are implementing these lockdown measures to combat COVID is in the DNA of the manner of policing in the country. That the state has not changed how it deals with citizens in this top-down, hegemonic, patriarchal, patronizing way. It hasn't changed. COVID is just exposing this in other interesting dimensions. And I think it really goes back to the point whether, is government out of control? Is it always been out of control?
Two things to mention here regarding the points we have raised. One, the WHO guidelines, although they are guidelines, they do not require in being implemented without domestication. WHO itself knows that you must think about how to domesticate those particular guidelines in a manner that is sensitive to local realities. And that's why some of us have been saying that the cut and paste approach is not going to succeed at all. Yes, the guidelines are there, they are very important, but there are ways that you can negotiate with citizens. You can now have ways of consulting with the citizens, and they will even implement them far much better than the government itself would, right? Because people also understand the consequences of the disease. People also understand that this is a life or death situation if there are more people who will be infected. So the point I was making is that, yes, it's a top-down approach, but African governments, and even in Kenya here, we never had any serious discussions on how to adopt these particular measures. But you are right, yes, this is the hegemonic control. It is an hegemonic kind of project, and we are going to see much more when the vaccines come. We are going to see much more of vaccine and support to immunize the populations, and gaining capitalist dimensions, a competition among the Western governments to load on African governments to take the vaccines itself. And that phase will come once the vaccine is in place. But let's go back to the issue of police and the way they have received these guidelines and the way they're enforcing them. That's the second point, sorry. We need to be very clear from the outset that our Kenyan police has not been reformed. The first time we had serious discussions on the reforms of the police force in this country was after the post-2007 elections. 2008, 2009, there was a lot of effort spent in terms of thinking about how to reform the police. And reforms of the police here meant democratizing the police force so that it becomes an organ for national development. In addition to policing, there were discussions about how to make the police force a democratic organ, an organ that actually promotes democratic order in addition to rule of law. But you very well know that those reforms never went anywhere. Even the constitution itself, the 2010 constitution, provided an opportunity for that. And to date, we cannot say that the police reforms that we have in this country are comprehensive enough. So what we have is the same old curriculum that we have in Kiganjo, the same behavior of the police that is passed from one policeman to another in terms of generations, from one generation of police to another. It's the same order that we have. And that order is very simple. The direction that is given from the top must be obeyed, irrespective of how it may have consequences on the people on which it is meant to impact. That's the governing principle. That's the code among the police. So they don't have a second thought to ask, what is the action that we have going to have? What is the impact of the action that we are going to have? And we must then start asking very fundamental questions. What kind of opportunity are we going to have ever again to reform the police force so that we have got a force that is a service to the citizens of this country? I can also, I think a very good example, let me just add to say that in all parts of this country, wherever you go, citizens see a police vehicle and run away. In democratic situations, citizens will not run away from a police vehicle because it's a service, right? That's the distinction that we have to make, because we do not have a democratic police force. Citizens will always be disconnected from the police.
So just one quick follow-up, and I'll let Njoki kind of get some of the questions that are coming from our listeners and the audience. Is this whole question, you and I have been in discussions where we talk about securitization of the state. You know, what I see now, we've really blurred the line between health and security. This, in many ways, in the implementation, has become a law and order question. If you look at the way that we've even managed the quarantine stations, the quarantine facilities, some of the young people who escape from these quarantine places say they were squalid. You know, in many ways, it just reminds me of what a police cell might look like. And in many ways, it's now become criminal to be COVID positive because of the way that you're treated, the contact tracing, and all of that has been very, very aggressive. So the question really is, you know, why has the government created a security and law and order problem out of a health crisis, which in many ways is going to pummel, as you pointed out, some of the poorer segments of our society who find it very difficult to implement the cut and paste WHO guidelines.
I'm losing you.
Can you hear me now?
Yes, I can hear you now. Repeat what you said.
Yeah, so what I'm saying is that it now becomes apparent that the government has blurred the line between health and security. They've made this a law and order problem. And what seems to happen now is that we've criminalized a health problem. And if you understand how this has spread in some countries like in Brazil, even in the United States, COVID is now quickly becoming a disease of the poor because of the socioeconomic determinants of health. Now, in our society, if you're going to implement cut and paste the WHO guidelines, this is not going to work in some of the places that we know that are densely populated. And the viral spread of this virus is going to be catastrophic in some of these poorer neighborhoods. And now when they test positive, they're still asymptomatic, they give their contacts, they will run to the hills. They will never show up. And this is just going to invigorate the spread of the virus. So what can we do as a country to basically address this fact? COVID is a health problem. It is not a security, law and order problem. Even to the extent that I might endanger your health, but I should not be treated like a criminal when I'm COVID positive.
Let me begin by pointing out that, yes, COVID began initially as a health problem. But I think across the world, COVID-19 is actually a test of not only the health systems that we have, it's also a test of resilience of our economies. It's a test of the governance systems that we have. In fact, it presents a very good opportunity for every country to check on its worth as a country and how the country itself relates to its own citizens. I am mentioning that simply because when you look at the West and the countries and even Southeast Asia, the countries that have been able to contain the spread of the disease, you have not seen it being securitized in the same manner as we are securitizing it here in Kenya. You may want to take the example of Mauritius, which is not very far away from us. they have not securitized it. But simply because the first inclination was to give the Minister of Interior the responsibility to help stop cessation of people from one place to another. Immediately that happened, COVID-19 and the control of COVID-19 took a security dimension. And that's why you find that instead of speaking to the population and creating awareness among the population, to create awareness among the people in Isilia, among the people in Kawangware, among the people in Kibra, instead of doing that, what you have done is to create roadblocks and big gates to prevent people from coming from areas where there is guidelines to prevent a cessation of movement. So from the very beginning, we gave coronavirus a security dimension. We gave coronavirus a security dimension. And by so doing, we have continued then to approach it from a security dimension. We are approaching it from a security dimension. But we may also want to start revisiting the whole question, as I said from the very beginning. How much consultations did we have? How much room was the national parliament, the senators and members of parliament, and the members of members of the county assemblies in this country? How much room or information were they given to have a discussion with their constituencies? Because had we taken that route, actually, probably we would have seen better control measures, which are being brought about through dialogue with the different communities. But the mistake we did is, of course, to present it as a police requiring a police situation or a problem that required maintenance of law and order. All that it required was to treat it as a healthy problem that requires citizens to become much more conscious on how to present it, to prevent it. And remember, let me say this, sorry, before I go, before we forget this. By the way, citizens reacted to some of these situations depending on how they see their leaders, what they see their leaders doing. The containment measures that we have, many citizens will not adhere to them as long as they see senior elites taking a helicopter, going to Kajiado, taking a helicopter, going to Kakamega. Those are signs of trouble. Those are ringtones of trouble for the citizens to do this. Remember, at the very beginning, when the Chinese plane landed in Nairobi with many Chinese passengers, citizens got very worried, and it took the action of one single citizen to bring this to the attention of everyone in the country. But immediately we put containment measures. Citizens were moving to Vika, were going to Naivasha, and the argument was that as long as we know a Chinese plane also landed, who are we not to do the same? Why are they preventing us? So I'm simply saying that the policies we have, what we do, the national leadership and its behavior itself may be creating room for citizens to doubt the measures that are in place. So there are several contradictions that have contributed, if I can say that. There are several contradictions that have contributed to us making coronavirus a security issue instead of looking at it from a very different perspective.
Right, thank you, Prof, for that. So your questions are coming thick and fast. So Martin Bikuru here is asking, is there anything positive that is likely to come out of the COVID-19 pandemic? What positive legacies are we likely to register as Kenya, as Sub-Saharan Africa, and even at a global level?
Thank you very much for that question. And I think, let me begin by pointing out that it is possible actually that people are likely to continue to lead healthy lives. The last 2 months, we have been told, if you look at the statistics, motor vehicle accidents have been on decline. Consumption of alcohol itself has been on decline. People are living much more close at family level than ever before. You see more people actually practicing healthy living, if one can say that, than ever before. So there are quite a number of things we can say are likely to stay in this new normal that we are likely to have. Masks, for instance, wearing a mask, which in itself is a good thing because it prevents the spread of other diseases, other flus, for instance. Is going to be a permanent feature maybe of many people. Social distancing itself is going to be a permanent thing. But there are also other downsides of it. Religious organizations, the churches, including the commercial churches that have been making a lot of money from by causing fear among congregations. People have realized that if you don't take a Holy Communion, there is nothing wrong, right? Centuries now, this is the first time in centuries, not less than 10 centuries actually, that people have not taken Holy Communion. This is the first time, in UK, name it, even. So there are quite a number of things that we are likely to see as changes taking place in the world. And I think people will start reflecting even on some of the churches that have been extorting from their congregations. There are quite a number of hard questions that people begin asking. But the other downside, of course, as you know very well, it's going to be the economy itself. We are going to suffer much more than expected this year, not only Kenya, but many other places. But that is not to say that there aren't a number of positives that are going to come out of this coronavirus. And to me, I would say that family values in many ways, especially families of the middle class who have been working, who rarely get time to sit home with their own families and with their own children. That's a big change. That's a big change that we are likely to see evolving and becoming part of our own values now.
So, Prof, early in your comments, you say that COVID is perhaps not the most important challenge that Kenyans are facing. They have bigger things to deal with, from poverty to unemployment to just ordinary insecurity and all of the other elements of dispossession and disenfranchisement. Nixon Orwa is asking whether, is suggesting that for poor Kenyans, when the choice is between police brutality and corona, they would rather contract corona than face police brutality.
I'm losing you, Alex. I can't hear you well. Alex?
So I'm saying that there's one of the listeners is suggesting that for poor Kenyans, and this is consistent with the earlier remark that Kenyans have bigger issues to deal with than corona. That includes poverty and just the daily stresses of eking out and living. When they're faced with, when they have a choice, when the choice is between police brutality and corona, they would rather get the corona, the COVID disease, than face police brutality. So it's like a choice, I would break the law, at the risk of getting COVID.
You have seen media commentaries. We have seen media commentaries on the scene, where the ordinary people have been quoted saying that I'd rather die of coronavirus than die of poverty, because how do I go and face my children in the evening if I have nothing for them to feed? That's one perspective. But most importantly, police brutality is not about being beaten by police alone. It comes with a lot of other consequences. For the ordinary people, if you are arrested by the police, first of all, you'll be beaten. You'll lose your money, and you'll lose a lot of time in the process. And if you don't give them money immediately, you are likely to be put in their cells until your relatives get some money to get you out of it. So that's why an ordinary person will say, wait a minute, if they arrest me and take me to a police station, there won't be any social distance to practice in the police station, right? There won't be any sanitizing that you'll have in police station. Wait a minute, but I rather actually break the laws on coronavirus than the rules on coronavirus than be arrested by the police. And this is a very clear choice that citizens make because of the nature of the police force in this country. It's a police force that is not reformed and therefore makes many Kenyans actually do things that they would not otherwise do. It's not only coronavirus where we get this particular kind of responses that I rather do ABCD than be caught by the police. Look at even the traffic police. When they arrest someone on the road, the time you waste, the kind of bribes that people cough up, and all things that really, really need not be done. That's what Kenyans are reacting to by saying they rather actually face coronavirus than face be affected by coronavirus with coronavirus than face police brutality. This is born out of the relationship between the citizens and the police in this country. That's a comment I would generally relate to, given what we have seen in this country with the police force. But remember also the poor are also making certain other observations. The poor are also arguing that, wait a minute, we have not seen the type of deaths associated with coronavirus in countries like Brazil, in countries like America, and in countries like UK. And there is also the conviction now, a running conviction, that maybe Africans are safer with coronavirus because of past immunization or because of the kind of climate we have, and most importantly, because of the young population that we have. So there are quite a number of observations that people are making, and sometimes we tend to think that those observations make people not to look at coronavirus as a serious threat to our lives.
Okay, so there is a question here where we're asking ourselves, why is it that we have a tendency to copy-paste solutions from the West? Is it that our governments are too lazy to have our own solutions? Can't we think for ourselves to have our own tailor-made solutions to combating COVID-19? And this listener, Joyce Wango, she's speaking back the words of Bob Marley, who's saying, how do we emancipate ourselves from this mental slavery and deal with COVID-19 in our own way, especially with regards to developing a vaccine, having it approved, the process, and having it mass produced, because it might take a while. So how do we arrive at that point of making our own decisions?
Yeah, who has that question, sorry?
Her name is Joyce Wango.
Joyce, thank you very much, Joyce. I think Joyce has raised very, very important observations. It's not that our governments are lazy. It's not that our governments are lazy, and it's not that the government cannot do better than this. But I think we have noticed that in the last couple of decades, our government has got very little respect for scientific research. Our government has got very little interest in professionalism, if I can call it that. Professionals and professional advice is never taken seriously in this country. But if a politician or an MCA issues a statement or gives an advice, I think that's likely to be taken more seriously than listening to a medical doctor advising the government on what to do. So to Joyce, I think the point is that the government is not lazy, but what has happened is very much in line with what has been happening in the last 20 years or so, where science is not respected at all. And secondly, we tend to respect what is given from the West more than what is homegrown in our own context. To digress a little bit, let me say that the University of Nairobi has been doing a lot of research on viruses and many other diseases in this country, in partnership with many institutions in the West. And I can tell you with a lot of certainty that we have got scientists at the University of Nairobi, and I believe other universities as well, who are very well informed about what needs to be done in this country to prevent the spread of the disease. And even who, if they were resourced properly, they would be also getting vaccines, maybe at the same pace and level and speed with the West. But I can tell you with a lot of certainty that the universities are very much under-resourced. Those scientists themselves are very poorly paid, if I can say that. And so there is no incentive. There is no motivation of people getting out of their way to address those particular challenges. And after all, even if you presented them, we know very well the context in which we operate. Science is not respected. I think we have got a tendency in this country for political elites to respect witch doctors than to respect scientists, right? And that's why you find that during elections, most of the political elites visit witch doctors rather than visiting polling farms to see the nature of surveys that have been carried out and how you're faring on. But I'm serious that actually we rarely respect scientific knowledge in this country, and it's across Africa. I talk to colleagues in different other universities. It's the same behavior. It's only in the 70s when, if we have to be very certain, it's 70s and 60s where science was highly respected in our context. If you look, Joki, let me remind Joyce a very grave matter here. Joyce would know that there is a time when a young kid in Nyeri invented, in quotes, an aircraft of some kind, actually. And because it was the talk of everybody in the village, it attracted the attention of the chief, and later on attracted the attention of the police. Instead of them finding out how best this kid can be helped to do better, the kid was actually threatened with arrest for being a public nuisance. I mean, those are kind of contradictions we should have, right? So we have got certain contradictions and certain challenges that make it very difficult for us to believe that our government actually is keen to taking science to another level. If you look at UK, if you look at America, if you look at Southeast Asia, universities are part of the enterprises that are emerging to address this particular virus, including China itself. And a lot of money being given to the universities, and a lot of money being given to scientific foundations to do different type of things. But here we are, Kenyatta University invented a ventilator. You have not heard how much money the government is giving to them to do better than, to improve on what they are doing. You have seen a certain polytechnic also that invented a hand washing machine. I think it's Kisii Polytechnic or Kisumu Polytechnic, I can't remember. We have not seen the government announcing itself to say that we are giving that particular department more money to automate what they are doing, and so many other things, right? So we are in a very contradictory moment, a moment that calls for major reflection.
So, Prof, in the next 3 or 4 days, President Kenyatta is going to decide whether to reopen the economy or not. What we've seen from other jurisdictions is no matter how great you've been at containing, blunting, bending the curve, there is an inevitable surge in numbers. The numbers will spike when the strict lockdown measures of social distancing, curfew, and all of those things are lifted. President Museveni just announced that on the 4th, he is going to open up the country. So public transportation is going to start working, but he's still closing churches, places of worship, and large gatherings. We've seen a contrast in styles and implementation. Even here in East Africa, in Rwanda, for instance, you have to send a short code message to the authorities, will then allow you to leave, and your destination must be known, how much time you're going to be out there, and they also monitor the frequency with which you've been out of, in and out of your house, because the retail sector has been made has gone online. So deliveries, you can make your orders, deliveries will be done, etc. Our neighbors in Tanzania only closed down schools and still opened up worship places. They've now said since yesterday schools have reopened. We're all going to get to the same endpoint, which is the next 5 days. All of East African economies will be back running. We'll have different endpoints in terms of how the virus will move after that. So the question is, has the economic imperative then outweighed the health considerations? Even in a situation in our country where we're just now beginning to see the early glimpses of what a surge might look like. The numbers are not terribly high, but they're in the hundreds compared to the single digits that we were used to over the last 40, 50 days. What are your thoughts? Is this a decision that the government should take lightly? In your view, should there be some consultation? Is this where we call Parliament to have a vibrant debate because they're the people's deputies? Would they then carry the aspirations of the people in this discussion? Or should the president, in his big house on the hill, just decide to decree that the economies are open because the economies are hurting?
Let me begin by pointing out that across the world, all economies are hurting at present, and I don't think there is any revenue authority anywhere in the world that is likely to meet its target. Growth rate in Kenya here are likely to be less than 2%, as we've been told by different analysis, through different analysis. It is good to start thinking that maybe it's the economic pressure that is leading to these considerations rather than health considerations. And this is what we seem to be finding out across the region. But what type of economic considerations? I think we need to start differentiating between pressures from the formal private sector, the big firms, and the losses that they are making, and what is it they can tell the government, because they're the ones with a lot of influence on the government. Or are we talking about the informal economy, the ordinary person, and the kind of economic activities he or she has, and therefore being affected in a very big way? Who is responsible for the pressure that is leading to this particular kind of decision? I think it's the big firms. I think it's the big firms because the ordinary person, economic activities, some of them, yes, could be hurting, but the informal sector, the informal trade is still growing. Well, it may not be growing that much, but it's quite active. The question then to ask is of what consequences this particular kind of pressure? And here I think your guess is as good as mine. Quite a number of things we need to observe here. To be honest, I don't think countries in Africa have come to, have found the reasons why the spread of virus has not been as fast as anticipated. Because it was expected that in the month of March, in the month of April, the month of May, that's when we are likely to see pressure on our hospitals, pressure on the mortuaries, and we have not seen this yet, right? It was expected that by now, by end of May, in Kenya here, we would be having thousands and thousands of people sick and unwell. The hospitals were said that, it was expected that the hospitals themselves could be having a lot of patients coming for treatment. And now what we hear is that some hospitals are even closing down. They don't have enough patients. They don't have outpatients, and neither do they have inpatients. So there are certain things that we may not say that the data that we have is available to tell us to help make a good decision on some of these things. But one thing is for certain, we are moving towards July. It's a cold period. We have seen that in both Southeast Asia, Europe, and America, the disease spread when it was rather cold during the cold season. And we have seen that in the last few weeks when it was quite cold in our country here, that's when the numbers spiked. If I was the government, I would start thinking twice before opening the entire economy and making it look normal for people to move from one place to another. We are being told that in Tanzania, they are not announcing figures anymore because the president, first of all, started doubting them. And his own statement of saying that you can take lemon and ginger and cure yourself, that doesn't help a lot. That doesn't help Tanzania a lot. We certainly know that their figures are very high, given the number of truck drivers who have been testing positive when they arrive in Kenya. If the truck drivers are testing positive, how about the other people who are mingling in the informal economy? So to be honest, Alex, I think if I were the government, yes, I would be very sensitive to the economy, but I would pay much more attention to what is it that needs to be done to attend to the needs of the ordinary person, rather than think about opening the entire economy without thinking about the consequences of open borders, open counties, and the movement of people from one place to another. But as I've said, if there was enough pressure on our hospitals, enough pressure on the mortuaries, I think the thinking would be different. I think the opinion driving this and the decision would be very different from what it is right now.
But Prof, you talked about, we've talked about the hegemony, we've talked about the dominant Western influence in even managing the pandemic. But we have two very good examples on the continent, Madagascar and Tanzania, that have decided to go about this against the convention. One, President Magufuli is on record to say that what does it help to go on public radio or TV and enumerate the dead and the morbid, or those who've recovered. Madagascar has this concoction that this herbal cure, which is in many ways got some validity in terms of the ingredients, the active ingredients in there. Artemisinin, which has been known as a combination therapy for malaria, which in many ways has had a better safety record on patients than chloroquine, for instance. So if you look at those two, would we say that when Africans try to claw back some independence, they're either second guessed by the West and demonized, or they're seen to be just not playing by the rules, because WHO expects every country to report the COVID cases in their territory. They expect that any drug trials must follow WHO protocols, and you cannot administer any therapies for COVID if they've not been approved. But some of the anecdotal reports that we're getting is that somehow this stuff works, but we're not throwing the necessary research to then counter the hegemonic Western canons of medicalized treatment, which is basically on manufactured drugs. What do you have to say about that?
Yeah, I mean, one thing is very clear here. Do not expect the West to be sympathetic with African governments, especially when it comes to science. Do not expect the Western governments, of course, to support Madagascar and the concoction that they have found, because, of course, of the usual thing, the usual feeling that nothing good can come from those particular kind of situations. The same hegemonic approach that we started talking about earlier. But we need also to start asking very hard questions about, for instance, in Tanzania, is that the best way of dealing with the pandemic or an epidemic? Supposing the numbers continue rising, will Tanzania be quiet, or will they start looking for help even from the neighboring countries, or even from the WHO itself? The second thing, of course, to ask, to lay on the table here is that we have also seen instances where African governments and African leaders, can produce a concoction and say that it can heal even HIV/AIDS. Remember Bongo Man? Is it President Bongo of Central African Republic? The Gambian president. All right. So we have got certain. We have a track record also of doing some very interesting things, and one may have to be very cautious with that. But of course, even if Madagascar was successful, I think it will take time, and a very long time, before the West approves it and says that this is sufficient cure for it.
Right. So there's another question here from Mr. Bikuri, who's asking, there's been an increase in digital surveillance, especially in Southeast Asia, China, and whatnot. Are we able to trust governments with our data? How do we prevent the abuse of data from citizens by governments when it comes to digital surveillance in the name of controlling COVID-19? Could they be using COVID-19 as an excuse to do something sneaky, seeing as we are even coming into an election period in the next maybe 48 months or thereabout? So what do you think about that?
This is an interesting question because it's coming at a time when we know very well that people who are going for voluntary testing are not giving mobile numbers. The reason why they are not giving the correct mobile phone numbers.
Hello, I think we're losing
sorry,
each
I'm saying,
other again.
Sorry, can you hear me? Can you hear me now?
Yes.
Hello?
Yeah, we can hear you.
Can you hear me?
Yes.
Oh, sorry.
Yes,
I'm saying this is a very interesting question. This is a very interesting question because it's coming at a time when we know very well that some people are going for voluntary testing. We've been told they have not been giving correct telephone numbers because of the same issues that we raised at the very beginning of this discussion, that we have criminalized coronavirus, and therefore very few people would be keen to go through the processes that through the process of quarantine. And this did not begin yesterday with the young men who have gone through this voluntary testing. If you look at the airport, the first time people came from out of the country and were put on forced quarantine, that would tell you a lot. Very, very few people would be interested in voluntary quarantine or even voluntary testing on account of that. But let's go back to the question of digital surveillance. In the country here, in Kenya, and many of the African countries, I would say, citizens don't trust their governments with the data. And the reason is very simple, that the citizens' data has been used for different purposes in the past. And therefore, yes, digital surveillance in Southeast Asia can work because the citizens hold their government in trust. They trust their government. They have got confidence in their government that this data is not going to be abused and misused in a manner that citizens don't like. They have got trust in the government, and the government themselves is a trustee of the people. It acts on behalf of the people. But when we look at how data is used in our case here, it leaves a lot to be desired. And a very good example, of course, in 2013 or 2012, 2013, when political parties were required by the registrar of political parties to show their membership. Many citizens do remember that political parties went buying from every reception of every building in this, they are of the visitors who have been coming to visit. And therefore, Alex may be a member of TNA, Joaquin may be a member of ANC without your knowledge. That's how it has been abused, even by different institutions, not even the government alone. Citizens in this country trust the private institutions more than anyone else. I can tell you that supermarkets in this country know more than you than the government knows about you. At a click of a button, every supermarket can see what Alex buys at the end of the month, what Jockey eats every end of the month. You can do that kind of analysis, depending on the kind of smart card you have. The government doesn't have that kind of data, and if the government asked you for that, everybody will be up in arms because of the manner in which the data has been used here before. So the point really to emphasize here, the government must get out of its way and show by deed and by action that it can act on behalf of citizens in a manner that fosters confidence in the citizens of this country. Trust is very important, and the levels of trust between the government and citizens have continued to deteriorate over the years. Especially when people start looking at the kind of repression we were talking about, and the fact that political leaders live for themselves and make policies in self-interest rather than for the interest of the citizens of this country. That has made citizens lose trust in not only political institutions, but also political leaders themselves, let alone the government in general. So if we were to go the way where we may want to have to use digital surveillance in this country, then it must come at a time when people have really established high levels of trust and confidence in the government and its institutions.
Right. So the last question here is from Michael Karinga. It's a bonus question. So he's saying that the government has been taking a lot of liberties with democracy. What is the future of the Constitution in the post-COVID era, especially with the looming constitutional amendment with the proposed BBI? Yesterday we had the president give a Madaraka Day speech where he said that we need to start rethinking our country and re-engineering the constitution. So I think there's been a lot of talk about changing the constitution for whatever purposes. So from where you sit, where do you think these conversations are going to go in the era of post-COVID, if ever there will be an era of post-COVID?
Let me say that there is not going to be a post-COVID era. Coronavirus is going to be endemic. It's going to be like influenza or any other flu. It's going to be part of us, maybe in different forms, maybe in a more virulent manner, maybe in a less impacting way, but it's going to be part of the society for many years to come, because it's a virus, and that's I'm not a natural scientist to say more about it, but I think if we look at what has happened in the past with other flus, this is not going to be different. So it's going to be with us. But all that we can talk about is that is thinking about post-lockdown, partial lockdown we have, post these measures that we have, what is going to happen. We can say with a lot of certainty that because the ruling elites and the political elites in this country in general prefer to implement reforms that are of self-interest, they will get out of the way and have a referendum that will foster their self-interest, or bring other changes through parliament, but changes that are concerned about addressing the political needs of the elites themselves. I mean, let's call a spade a spade. Political elites in this country are not for the ordinary Kenyans anymore. The era of nationalist leaders is over. What we have now are what you can say self-centered political elites whose drive for reforms, whose drive for change is of course driven by very narrow short-term interest. And when I talk about narrow short-term interest is among everything else, to emphasize the point that politicians really make changes that will see beyond, changes that can last beyond 5 years. Their focus is usually a period of an election. And after that election, they begin another process for change. So we are likely to see changes coming, changes that may include an expanded executive, because what we have seen in the last 3 weeks or so is an expansion of the coalition in parliament. That expansion of the coalition in parliament is not going to be for nothing. It's an expansion of a coalition in parliament with a view to passing certain laws, endorsing certain changes, and we are likely to see that coalition leading the country into a referendum. If you ask me a referendum about what, I mean, your guess is as good as mine. I don't know what may be the key questions there other than the expanded executive. Maybe to appease Kenyans, they may include increased resources for devolution or for devolved units. But remember also the ordinary person is questioning the level of corruption in the county government. Some of them say it's quite high, therefore they cannot agree to more resources being given to the counties. The last point to make is, please remember that referenda in this country have always been very polarizing, very polarizing. The 2005 and the 2010 are very good examples. If not handled very well, they may create conditions for a very violent 2022 election. Because referendum by its own nature is simply about a vote on the government, because the government will be pursuing a certain line and seeking support for it. And if the government loses in a referendum, then it creates conditions for greater polarization towards the election period.
Thank you so much, Prof. That's all we had time for, and now I'll hand over to Gitonga.
Ladies and gentlemen, this brings us to the close of episode 7 of the Understanding COVID-19 series, brought to you by the Media Innovation Center, the Aga Khan University, during which we discussed the topic, governance and accountability. Is the state out of control? Thank you very much for joining us, viewers and listeners. A special thank you to our guest, Professor Karuti Kanyinga, Research Professor, Institute for Development Studies, our moderators, Dr. Alex Sawiti, Vice Provost East Africa and Interim Dean of the Graduate School of Media and Communications, and Ms. Njoki Chege, Media Innovation Center Director, both of the Aga Khan University. Join us next week on the 9th of June 2020 for episode 8 of the continuing series, where we will host Phyllis Wakiaga, CEO, Kenya Association of Manufacturers, when we will explore the topic COVID-19 and Kenya's manufacturing sector, impacts, opportunities, and lessons learned. Do not forget to follow us online on our Facebook and Twitter platforms at AKU Media Futures. That is at AKU Media Futures. Once again, thank you and have a wonderful and safe afternoon.
Thank you. Thank you very much, everyone.
Thanks, Prof.
Thanks, Prof.
Asante. Thank you very much. Asante.
Okay.
Thanks.
Thank you.